Hello friends, this is Dr. Sudarshan Ray bringing to you the latest in the series of psychoeducative videos which are aimed at raising awareness on mental health issues plaguing the society. Disclaimers are that there are no conflicts of interest, no fundings have been received for this video, and these videos are merely to raise awareness in the society amongst the common people on mental health problems, so they are motivated and guided enough to seek treatment from a qualified mental health professional. Okay, so today we are going to discuss in brief about the antisocial personality disorder. Now, you have seen lately uh, the case of two ladies, a mother and a daughter, supposedly murdering their aunt and trying to dispose of their body in a ghat in North Kolkata. Okay. Now, whatever be the reason for it, I mean, whether motivation rather, whether it was money or some other issues, and whether they were actually guilty or what actually transpired is for the law enforcing agencies to decide. Today, we are going to discuss that basically what actually could have made these two ladies act the way they did, that is, brutally murdering their aunt and trying to dispose of the body in a very grotesque manner. The personality disorders are mental health conditions that basically affects how one thinks, perceives, feels, or relates to others. These people actually, there are various types of personality disorders. There may be obsessive compulsive personality disorders, there may be borderline personality disorders, and various others. And basically, these people find it a bit difficult to gel with all and sundry. Okay. A person with a personality disorder, frequently you will see that he is not able to adjust to any sort of environment. I mean, a person may not be able to adjust to a certain environment or quite a number of environments, but if he or she is not able to adjust, get along in any sort of environment whatsoever, then we can actually suspect, a layman also can suspect, that it may be due to personality disorder. Okay. Now, basically, personality is something which is not quite inherited, though now a biological connection can be established. So, we learn from our own society when we were small. We learn from our parents, then our friends, then in the locality, then our friends at school, at college, in the workplace, and otherwise. So, to every action, we received a reaction, and from that reaction, we learned a lesson. It's almost like the pixels on a TV screen. I mean, to each and every action, there's a reaction, and that reaction results in a lesson being learned, which is a pixel, and number of pixels make up a megapixel, and a number of megapixels actually make up the TV screen, which may be considered as our personality. Okay, so I mean, this is what his personality is all about, and in antisocial personality disorders, it is particularly a challenging type of personality disorder that is characterized by very much irresponsible behavior, impulsive behavior, and criminal behavior. So that's what we are all concerned about. I mean, we perhaps noticed a criminal behavior recently with these two ladies and their aunt. Now, someone with antisocial personality disorders will be manipulative, they will be deceitful, and basically, people with antisocial personality disorders do not care for any other feelings. They care only for their own feelings. Now, now, like other personality disorders, even antisocial personality disorders, the severity ranges from from the occasional bad behavior to extreme bad behavior, breaking the law, and creating these various serious committing these various serious crimes, like what happened recently, perhaps. Okay, now Even another extreme is the psychopaths who may be having very extreme or severe form of antisocial personality disorder. Now, a person with antisocial personality disorders, as I said, will be manipulative, they will be cunning, they will be deceptive, they do not lack any concern, any feelings, any empathy for other people, they behave irresponsibly, and they do not actually gel with the normal social behavior. They do not have any guilt. Okay, they have very bad anger management issues. They blame all and others for the problems, and they cannot sustain any long-term relationships. But that is a characteristic of all personality disorders, and of course they always have run-ins with the law. They break the law. Okay. Now, a person with antisocial personality disorders, if you take the history, a detailed history has to be taken of their childhood. There may be, this person, they actually may have these problems, or surely would have had these problems in school also, playing truancy, or getting into substance abuse, alcohol, drinking, smoking, etc. at a very, very early age, then committing crimes like theft and even molestations, etc. When they were very young also, and frequently they drop out of school, or made to drop out of school, or made to drop out of their jobs for this. Okay. Now, in case of antisocial personality disorders, basically it is not very well known, but genetics and obviously a troubled childhood, being getting beaten up in the child abuse, or even sexually abused, may actually contribute to these personality disorders being developed in the person later on, the antisocial personality disorders. If the parents are abusive of alcohol or any drugs or anything of the thing, and they beat each other, up, it has been seen that both persons are very aggressive, or maybe one of them actually bears the brunt. Basically, the wife in most cases bears the brunt, and the child is seeing all these things and getting influenced, and obviously this leads to behavioral problems later on in life, and criminal behavior is a result. Okay. And basically the person may commit crimes, or petty thefts, and then serious crimes. Then it has also been seen that these persons, they commit the crime for a very erroneous interpretation, a misinterpretation of the circumstances, or anything of the sort, thinking that people are basically their enemies when their own family members. Many years back, a young lad basically murdered his stepbrother, his stepfather, and his stepmother, along with his friends, and he was jailed, and then he got out of jail, and once again he committed the theft and other crimes. So these things, you can see, the traits one can actually recognize in early childhood also, or in when they are teenagers, and basically that time the treatment has to start. And it has been seen that most of them, they abuse alcohol and drugs and any of these things. Now, they always have these relationship problems. Okay, they always have, they cannot sustain any relationship, and they most of the times they're extremely dominating also. And a person to be diagnosed with antisocial personality disorders, it is generally, we take the age of 15 years as a standard, that these problems must have been present, should have been present before the age of 15 years of age. And then the diagnosis is finally made when the person is 18 years old, and at least 3 of the following criteria they apply: that they repeatedly break the law, they they are deceitful, they are cunning, show cunningness and cheat people. They are always impulsive. I mean, if they have an argument with someone, they beat them up without thinking of the consequences. Always very irritable and aggressive. Even without provocation, they get angry. And when they get angry, they do not regard, I mean, what is they have no control over their own safety or the safety of others. They are only intent on harming and venting their anger. They are irresponsible, and obviously what's main is that they lack something known as guilt. The guilt actually prevents us from committing further mistakes or even heinous crimes in case of criminals if they have this sense of guilt. But this guilt is not present in this antisocial personality disorder. Okay. Now, it becomes very extreme in the age, as one crosses 20, etc. And one of the most difficult personality disorders to treat, all right. But obviously, the persons with antisocial personality disorders, we have to naturally, they are patients, they are mentally ill, they have mental health issues, so we have to speak to them. And the person's family and friends will play a very active role, okay, because they are part of the society, and it's antisocial personality disorder, isn't it? So obviously a person has to be included in the society for the treatment. Cognitive behavioral therapy certainly is used, and this is aimed at making the person identify their problems, their their defects in thinking and their behavior, and they should challenge their own behavior and basically try and get their thinking right. There is mentalization based therapy, MBT. MBT is a type of talking therapy, and the therapist over here will encourage the person to consider the way they think and how the mental state affects their behavior. The therapy should not basically accuse this person with antisocial personality disorder of wrongdoings, etc., etc. But his aim would be in mentalization based therapy would be to encourage this person with antisocial personality disorder to consider. I mean, he can appeal, ask for consideration, so that they can actually understand the defect in their behavior and challenge them also. Democratic therapeutic communities are there, and they are quite effective. It's a type of social therapy, and that aims to address the person's risk of offending, as well as the emotional, as well as psychological needs. Now, the groups may be small or maybe large, and obviously it's a more of a cooperative sort of society where the therapists, the staff, and the prisoners, antisocial personality disorders are frequently imprisoned, and the treatment is carried out over there. So they are not a threat to the civil society, and obviously they have to be engaged in some sort of work, some vocational work, and where they are they receive some remuneration, some contingency management, and the person, the recommended length of treatment will be close to say 2 years, and the person has to be given sufficient time. And self motivation over here is the most important factor, because if the person has to be willing to work in the community and participate in all these activities, this democratic process and this mentalization based therapy does help. So the person is actually willing to work, because as you know, in all my other mental health issue videos, I've talked that if the person does not himself is motivated, then basically no amount of medicines can cure him. So we do use certain medications like carbamazepine, even lithium, and SSRIs to treat and control the anger outbursts and the mood swings, etc. And the aggressive behavior can also be controlled using these medications. However, this is just one or two names I've taken, molecules I've taken, but this should not be construed as a directive to treat personality disorders. Okay, so obviously, how unpalatable a person, unacceptable a person with the antisocial personality disorder may be, they should be treated, yes, under close supervision and in a correctional home, and given the proper medication and obviously mentalization based therapy, cognitive based therapy, etc. They do work. And in case of these ladies, if when the law takes its course, as and if they are convicted, they should be treated in the same way. If you like my video, do share this so that it helps me to raise awareness in the society on common mental health issues. So till the next video comes in, is bye from my end. Do subscribe, like and comment on my YouTube channel too. Thank you very much.